So hello, this is Basic Ankle Anatomy from a publication which you can kind of see down here in 2010. Beautiful pictures. Lateral ankle here, lateral malleolus, fibularis tendons running posterior and extensor tendons running anterior, and we can kind of see the talocrural joint here, anterior talofibular ligament, and then the subtalar joint. And here we have a close-up of the mortise of the ankle. You can see the distal tib-fib ligaments here and that syndesmotic connection which forms the mortise. We see the trochlea of the talus here. The calcaneus is down here, so we know that this is the subtalar joint here. We see the anterior talofibular ligament and the calcaneofibular ligament here. Again, focusing on the lateral side of the joint, we can see the mortise, distal tib-fib ligament, trochlea, anterior talofibular ligament here, calcaneofibular ligament here, and then here's a subtalar joint here and then here. So here we look at the function of the anterior talofibular ligament and the calcaneofibular ligament. It's making a point that the function is different whether the joint, talocrural joint, is in neutral, dorsiflexion, or plantar flexion. So posterior in this picture is to the left, and then we can kind of identify bony landmarks. So here we have the lateral malleolus, trochlea, so this is the talus here, here's the subtalar joint here, so this is the anterior talofibular ligament, here's the calcaneofibular ligament, and we can kind of see in this position that the anterior talofibular ligament is going to kind of limit anterior drawer of the talocrural joint, and that the calcaneofibular ligament would mostly limit inversion of the subtalar joint. We go into dorsiflexion. We can see that the calcaneofibular ligament is stretched some, but it would also limit, continue to limit eversion, so it gets stretched in dorsiflexion, and the anterior talofibular ligament would up here be relaxed. And then we see here in plantar flexion that the calcaneofibular ligament here would be relaxed and that the anterior talofibular ligament would be stretched. So now we go to the medial side of the joint. So medial malleolus, we have 4 bands of the deltoid ligament or the medial collateral ligament of the ankle. We can see that the tibia or the tibio-navicular band is here in the front, or anterior tibio-talar band, a tibiocalcaneal band, and a posterior tibio-talar band. The tibiocalcaneal band limits eversion, and then the tibio-talar bands stabilize the talus with the tibia, and then the tibio-navicular band crosses the mid-tarsal joint. So here we have the medial side of the ankle. We can see the deltoid or medial collateral ligament here, just deep to the posterior tibial tendon here, and then we see the 4 bands of the ligament here when the tendon's been removed. And in plantar flexion, we see bottom left here that the tibio-navicular band and the anterior tibio-talar band are taut, stabilizing the talocrural joint. And then here in bottom right, we see in dorsiflexion that the posterior tibio-talar band and then the tibiocalcaneal band are taut. Okay, here we have the overview. So we have an anterior view and a posterior view. The anterior view, we can see the mortise and then the trochlea here. We have the anterior distal tib-fib ligament here. We have the anterior talofibular ligament here, and then we have the medial side of the joint here. So we have the tibio-navicular band of the deltoid ligament, and then we can see the sinus tarsi here. Here's the posterior joint. Now we can kind of see the talus is here. Here's the subtalar joint. So we can see the posterior talar fibular ligament here, and there's like a little band that goes to the tibia there. Okay, and then this is a posterior view of the calcaneofibular ligament. And that's the review.